Assalamu alaikum everyone. Welcome to Medical Education Nepal. In this video we are going to discuss how you can prepare for your OSPE as well as your Viva board for forensic medicine. So on your examination day, first of all you enter your department, and after you go into your department, the first thing that will be taken is your OSPE, that is the oral structured practical examination. It's like almost 30 to 40 minutes, and there are lots of weapons and poisons, and you have to just describe them. You have to solve some questions in a written form. Okay, so for my medical college, there is a OSPE question bank. This is given over here. For different medical college, there are different OSPE questions. I don't think so there is any specific OSPE related questions that comes from Dhaka University during the professional examinations. These questions are usually set by the internal department. The internal department, the forensic department, they usually set these questions. Okay, so here is the questions of my medical college, and I'll try to solve few of them. Okay, the first is the rope, to describe the weapon rope. So there are two things that you can do. One thing is you can just simply write the supplied sample is rope, or the another thing you have to, you can describe this is soft, blunt, non-metallic, twisting weapon made up of jute fibers called rope. Okay, so anyone you can do, there's not a problem. But if your medical college, the teachers, if they've specifically stated that you have to describe the weapon, then you must have to describe the weapon. Okay, so the second thing is, what are the injuries caused by it? Okay, so what injury you get? First of all, you will get the bruise. Okay, so what kind of bruise? There is a trampoline contusion or railroad contusion. Okay, and then there is this abrasion. You can also give here like the grievous hurt. The rope can cause grievous hurt by causing blindness in the eye. So you can write those points. After that, there is the cause of, what are the causes of death in case of hanging? So there is an immediate cause, there is a delayed cause. The immediate cause, there is asphyxia, visceral congestion. Then there is a combination of both of this: vagal inhibition, cerebral anemia. And in the delayed cause, there is aspiration, pneumonia, infection, abscess of the brain, infection of the brain, septicemia. So these are the things you have to solve them. Then there is a shotgun cartridge. Identify the specimen. The supplied sample is a shotgun cartridge. Okay, I usually used to, in the terminal examination, I described the supplied sample is this. Okay, but during the professional examinations, I didn't took any risk, and might be if the OSPE paper, if these are checked by the internals, then if I have described the supplied sample is a soft, blunt, non-metallic, twisting, and all that, so there is less chance of cutting any marks. Okay, so if you get time, then you just describe all of them. Okay, it's kind of hard to manage time during the OSPE. Then there is a name the different parts of a shotgun cartridge. There is metallic base, plastic case, cardboard bricks. What are the benefits of rifling? It gives, it prevents from unsteady course, gives spinning motion, the identification of the bullet. So these are the things. Then there is knife. Okay, then there is dagger, also saving blade, chalan, and lots of things. So usually what happens is there are 30 items given over here, but usually you will get to know that what you get in your examinations. There is also what do I say? Okay, there is oxalic acid given over here, but usually oxalic acid is not given in my medical college. There's copper sulfate, it's usually not asked. So it depends. Okay, so you just have to go to your own respective medical college, your own department, and you have to ask them, give me the question bank for the OSPE questions, and you just try to solve them. Okay, you solve them, and you will obviously get prepared for your terminal as well as your professional OSPE examinations. Now coming after that, after you give your OSPE, then you will enter your board examination, my Viva board examination. There is two boards, board 1 and board 2. Board 1 is of weapon and board 2 is of poison. Okay, so what you usually what happens, you like the first half roll is divided, and they go into the board 1, that is weapon board, and the next half is going to the board 2, and they from the in the next day usually the board changes. Okay, so you also have to consider these things. So the thing is like you carry your 2 practical books, okay, practical notebooks. One is of weapon and one is of poison, and then there is also the medical documentary evidence, and that is a spiral paper, you know, spiral khata, you used to say, spiral notebook, and then there is your autopsy report. Okay, so what you do usually, what we usually do, we used to like took all of them, all those 4 things, 2 practical notebook, that medical documentary evidence, and then autopsy report. You used to take all these 4 things and go into the first board in which we are assigned. If we are assigned at the board 1, then we take all the 4 to the board 1, and if you are assigned to the board 2, then we take all the 4 to the board 2. So after entering your, suppose I get board 1, okay, so after entering my board 1, I give all the 4, I give first of all salam, you know, I have to say assalamu alaikum sir, assalamu alaikum ma'am, if there is a ma'am. So after you greet your external, after greeting your external, then if they are told you to sit, then only sit. If they don't tell you, then just stand still over there, okay, until they give an instruction. So after that they will they will tell you to sit, then you sit down. Then after that the teacher will ask you, give me what you have brought. So after that the teacher might ask you like what you have brought, what is the name of this, or they might just skip the part. Usually the first few students, the teacher used to ask what you have brought, like what are the names, what you have seen in your autopsy, you know. But after 5, 6, you know, the teacher also like they used to skip this part. Okay, they don't used to usually ask, and they just jump into the viva section. So if suppose you get your teacher ask you, okay, like what you have brought, then what you will say? For the spiral khata, you will say, sir, this is the medical, I have brought medical documentary evidence, and then there is autopsy report, and then there is a 2 practical notebook. Okay, the practical notebook usually don't have any significance. The teachers usually don't used to ask any question from them, but they do carry marks. Okay, they do carry marks. And like in your medical documentary evidence, okay, medical documentary evidence, the teacher might like ask you what evidences you have in over here, or the teacher might directly jump into, okay, classify medical documentary evidence, okay, in this way also. And usually in my medical documentary evidence, my college, there is usually sickness certificate, fitness certificate, birth, date, and then there is a 5 injury report, and then there is a 5 victim examination report. So altogether there is a 14 reports in the medical documentary evidence of mine. Okay, so as much as I remember, the external ma'am asked me like in the board 1, okay, you brought your medical documentary evidence. In the fracture section, okay, there's injury report where there is a fracture, like grievous hurt type of question, you know. So tell me the opinion. She asked me like give me the opinion of one of the injury report. So I just told you there is like injury number 1, there is grievous hurt, and injury number 2 is there is a simple hurt. Usually these are the same for almost all of my injury report. You know, there is a few that there is a 2 simple hurt or 2 grievous hurt in this way. So I gave the opinion like one is the sir ma'am, one is the grievous hurt, and one is the simple hurt. So in the grievous hurt, then the teacher proceeded like, okay, tell me what is the grievous hurt, define it. Then there is a points of grievous hurt. In this way the teacher proceed, as much as I remember, in the board 1. Okay, now this is things that is asked from, you know, the medical documentary evidence. Now okay, these are only the things. Now in the autopsy report, the teacher might ask you a few questions like okay, what autopsy did you see? Okay, so as much we have seen like almost, you know, 10 autopsy there is given, and you have to say like, yes ma'am, I have seen like 10 autopsy. There is a poisoning case, there is like a drowning case, there is decomposed body, you know, this type of things. So usually in the autopsy report, the teacher used to ask, okay, tell me the opinion, the poison opinion, what you have written over there. Tell me the opinion. Okay, so in the poison, there is two opinions. When you will prepare your autopsy report, you will also give these two opinion. One opinion is that opinion is kept pending till the chemical analysis of viscera is what you received. Okay, and another is considering the post-mortem examination and chemical analysis report of preserved viscera that was due to asphyxia leading to respiratory failure resulting from the ingestion of organophosphorus compound, which was antemortem. Okay, so up to this much. But in case of hanging, we also write this, which was antemortem and suicidal in nature. So one contradictory things come over here, like for which case we have to give the nature of death, and for which case we don't have to give the nature of death. So it's very simple, you have to give, you don't have to give nature for poisoning case, for drowning case, then there is electrocution, then there is a fall from height, then there is a road traffic accident. Okay, poisoning, drowning, electrocution, fall from height, and then there is a road traffic accident. For these cases you don't have to give opinion, and for rest you have to give opinion like hanging. Okay, so these are the things. So apart from this, I don't think so there is any thing that was asked, but can ask there's two opinion basically. One is the poison opinion, and then another is the hanging opinion. Okay, so hanging opinion is also usually asked, like in my opinion that was due to asphyxia leading to respiratory failure. Okay, which was antemortem and suicidal in nature. You have to give the nature of the death. So these are the things that is asked from autopsy report. Now moving towards the viva board. Okay, now you will have the tray. Okay, you will have the tray of weapon, but you don't have to say, sir, this is the tray of the weapon. If the teacher asks you like, okay, what is this? Okay, so you say, sir, this is the tray of mechanical devices. When used illegally, it causes mechanical injury called weapon. Okay, so this is weapon, but these are not weapon. Okay, how can you say like if there is like paperweight, how can you say this is a weapon? This is not a weapon. This is a mechanical device. If there's only thing that is weapon is like the pistol. Apart from that, the knife, how can it be a weapon? It is also used in chopping, in the kitchen purposes. So these are mechanical devices. When used illegally, then these are known as weapon. Okay, so this is the thing for after you enter your board. Now the another thing is there are some box questions that is set by your respected medical college. Usually the box question is asked, it depends upon your medical college. In my medical college I don't see, for both the board 1 and board 2 I gave, the teacher didn't ask anything from the box question. They didn't told me to pick up the box question. But yes, again, the next day of the examination the teacher picked the box question for some students. So it depends upon the mood of the teacher, it depends upon how you present. If you present very well, then might be the teacher don't know, you usually ask. So this is the thing. But you definitely solve all the board questions. I have like board questions, these are like very simple. If you have gone through your syllabus, you have gone through your written examination, then this will definitely not be a problem. Like the question here is like what do you date trance? So what is date trance? Date trance is like also known as apparent date catalepsy. Basically it is a death-like condition of a body which is usually not dead, but his like respiration and the vital systems are minimized or interrupted, and which can easily be detected by ECG, EEG. So these are the things, like what is the difference between dying declaration and dying deposition. Obviously it comes under the medical documentary evidence, but dying deposition is not under medical documentary evidence, that. Okay, so what is fee sharing of fee among the children? Okay, defined court, institution where laws are to be executed. So these are the things you have to solve. Before entering your viva board, you have to make sure that you solve all of your board questions. Okay, all right. So after you gave your examination. Okay, after you solve your board question and you enter into the Viva board, and in the board one, in the weapon board, you told, if teacher asks you, you told like, yes sir, so this is a tray of mechanical devices if used illegally known as weapon. Okay, so after that the teacher, there is 99% chance, okay, there is 99% chance that the teacher will tell you to pick up any of the weapon. Okay, pick up any of the weapon means a teacher will tell you to pick up okay, you pick up knife, you pick up this, or the teacher will tell you like, okay, what you have prepared the best, you pick up that. So this is the thing, 1% the teacher just leave the board and then start asking without the picking of any weapon, just start asking randomly. So this is usually not the case. In 99% of the case, the teacher will definitely make you pick up a weapon. Okay, so after you pick up a weapon, in my board, the external made me pick up the wooden roller. Okay, told me to describe, I described it, and after that, she asked me, the first question was, okay, yes, the first question was, can this wooden roller do grievous hurt? Yes, definitely it can do grievous hurt. But then she asked me what, so I told, ma'am, fracture and dislocation. So now she told me, okay, you tell me if I what do you say, if you strike this in English, she told me in Bengali, but I told in English, if you strike this roller in your head, so what injury will occur from outer to inner part? Okay, she asked me like this. So I told her like, okay ma'am, I know this. I told there is injury to the scalp, then there is injury to the skull, then there is skull, then there is injury to the brain, and then lastly there will be injury to the meninges. So further I described injury to the scalp, there is abrasion, bruise, laceration, incise zone. Then there is an injury to the skull, there is a fracture fracture. Then she told me, okay, classify the fracture. I told the fracture, the fissure fracture, depressed fracture, comminuted fracture, pond or intended fracture. So after that, what question she asked me? Scalp injury to the scalp, injury to the brain. Okay, I guess so. The questions, okay, see, after the describing the types of fracture, she goes into the grievous hurt. The grievous hurt, tell me the point. Grievous hurt, the grievous hurt point I told. And then she told me to describe the emasculation. Emasculation, then what is defined emasculation? It is loss of masculine power of a male. Then what is the cause of emasculation? I told that. Then there is what do you question? Okay. Okay, these are the things. Okay, after the, I currently don't remember, it's been a long time, so it's not getting into my mind what questions were asked. Okay, after this, I guess she moved into another topic. She moved into like post-mortem death. What are the changes after the after the death? So there is immediate change, early change, and then there is a late change. She asked me about the early change. Then after early change, she told me, okay, you told changes in the muscle. So what changes in the muscle you get? So I told my primary flaccidity, then rigor mortis, and then secondary flaccidity. So then she went into the rigor mortis definition. Then time since death. What is the importance of rigor mortis? How can you know the time since death through rigor mortis? So there is the march of 12, the rule of 12, 12, 12, 12. It is well maintained in 12, it is well developed in 12 hours, maintained for 12 hours, and then it disappears after 12 hours. So altogether there is 36 hours. I guess this was my last question, but probably there are lots of questions that she asked me. I don't remember right now, So these are the things. So apart from this, what you can do in board 1. So these are the things board 1. Usually what happens, usually if teacher asks like, okay, you pick up a weapon, then student usually pick up the knife, and the teacher also you give knife. Knife is for it contains lot of questions. So if suppose if you get a knife, you know how to hold a weapon. I told I told everything in during the classes, in my on the videos. In the topic wise discussion of item, you can know how to hold the knife. What questions are asked in written, and what questions is important for written, and what questions are important for Viva. I've all marked those questions. I've told them item videos. So if you haven't watched the videos of item, I suggest you to definitely watch the weapon video especially. Okay, so suppose you get a knife. Okay, so I remember my first term was the sir asked me to, okay, pick up the knife. I pick up the knife, I describe the knife, and sir asked me medical legal importance of knife. So I told homicidal, suicidal, accidental, I told. Then I remember, yes, sir asked me like, okay, through this knife, sir, like tricky question, through this knife can a person do suicide? Then I told, yes, sir, definitely do can suicide. So what type of, I told, sir, cut throat wound. There is a cut throat wound, two types I have already discussed. There is homicidal cut throat wound and suicidal cut throat wound. Suicidal cut throat wound, what is the common side of suicidal cut throat wound? This radial artery, wrist of the hand. Okay, so, and homicidal, what is? Nape of the neck. So then after this, sir asked me like, suicidal cut throat wound, what are the cause of death of cut throat wound? Okay, there is a hemorrhage, shock, infection, local abscess. So these are the things. Then after that, he asked me like, what's the difference between suicidal and homicidal cut throat wounds? Then I told that there is a level of the neck. Then there is a suicidal is above the thyroid cartilage. Then homicidal is below the thyroid cartilage, and then there is hesitation cut, cadaveric spasm, tailing of the wound. These are all present in suicidal but absent in homicidal. Homicidal, there is a defense cut is present. So these are the things. Apart from this, what is important? So it depends, what kind of weapon. If you get knife, then definitely the cut throat wound questions will arise. If you get rope, then definitely hanging questions will arise. And in hanging, I've told you like what type of abrasion, pressure abrasion. This is important. You should know. Then there is okay, inside wound, inside looking wound. What is the difference between those? Okay. Then there is a stab wound, there is a perforating and penetrating wound. Okay, so perforating wounds, sir usually may ask, if you are a girl, then sir will ask like, okay, what are the perforating wounds present in your body? Then you can say there is nostrils, then there is ear lobules. This is all. And usually knife and dagger, these are usually same, but in case of sickle there is a serrated edge. Serrated edge will cause laceration, not incise wound. Okay, so this is the thing. About wooden roller, I told wooden roller is related with the fracture and dislocation. There is a split type of laceration. Okay, there is one more question. Like suppose if a person get into a road traffic accident, or if there is any injury, then what will be the cause of death? Okay, so I have already discussed in my item. There is the effects of wound. You have the effects of wound, the effects of injury. The first thing that it is categorized. Okay, there is immediate and there is a delayed. So first of all, you say, sir, the cause of death will be hemorrhage. Then after the teacher asks you, okay, tell me more. Then there is a shock. Then they introduce the vital organs. Then there is a delayed effects. There is infection, ARDS, renal syndrome, and all that. So these are the things. Okay. Time since death is also important. The postmortem interval, when is the rigor mortis, it appears 1 to 2 hours after death. Okay. For cardiac muscle, it appears within 1 hour. The rigor mortis, there is the order of appearance. That is known as Nisten's law. I guess Nisten's law it is known as the order of appearance. Then there is the order of disappearance also. There is internal and external. Internal, first of all, it will appear in the cardiac muscles. Then external eyelid, upper eyelid muscle of the eyelid. So these are the things you should know. One thing I'm not sure of, like stomach wash tube. Stomach wash tube we have studied in the poison board, but if I don't remember usually it was whether it was in weapon board or whether it was in poison board, but it doesn't matter, you know, if any board it is. But the only thing that asks from usually here is the contraindications of stomach wash tube, and then there is complications of stomach wash tube. Apart from this, the teacher can also ask like give the entire procedure. How will you insert the stomach wash tube, and how will you take out the poison? How will you preserve for chemical analysis of viscera? You know, sorry, chemical analysis. Okay. For firearms, where the pistol, the sir will ask like the parts per breech and barrel. I've already told that. For shotgun cartridge, definitely the parts, the composition. Paperweight, okay, the paperweight, you know, for paperweight is also kind of similar with the fracture and dislocation. Okay, abrasion bruise also it do. For the and knife it is same. Okay, there is also the safety razor blade. Safety razor blade also, you know, it causes cutthroat wound. There is a cutthroat wound, that is incised wound. These are also important. I've already, like in detail, I've discussed in my weapon video. I suggest you to do that. Then there is alpine. Alpine also, you know, penetrating, perforating wound. There is infant. Then medically, legally, there is a concealed puncture wound, infanticides. So these are also important. You have to approve from this. The teacher will go into the infanticide. Then there is a concealed puncture wound, sites of concealed puncture wound. In this way, the teacher will go infanticide cause. What is the motives of infanticide? What is the modes of infanticide? Act of commission, act of omission. Okay, so I guess so. This is only the things about the first board. You know, the first board. Once again I told you there is like. Weapon board. In the weapon board, you know, you will get everything in the first term what you have studied: introduction to legal procedure, BMDC, BMA, autopsy, identification, death, post-mortem change, starvation, blood and seminal stain, artifacts, mechanical injury, medical legal importance of wounds, ballistic, bomb explosion, regional, thermal, electrical injury, road traffic accident, hanging, strangulation, mechanical asphyxias, drowning, weapon, and medical legal certificates. So this was all about the board one. Okay, so thank you everyone. If you have any question, then you can also write in the comment section. I will definitely give you the answers. Okay, Assalamu alaikum.